Lagos State AIDS Control Agency has brought hearing and visually impaired people into its HIV prevention training net. This, they say, would help reduce risk-taking behaviors among the already vulnerable people. Have a listen.
An estimated 650 million people, or 10% of the world's population, have a disability. The relationship between HIV and disability has not received due attention, although persons with disabilities are found among all key populations at higher risk of exposure to HIV.
I see that you're all listening with rapt attention.
The need to improve their knowledge on HIV prevention, care and treatment is the essence of this special class. Monsurat Adeleke is taking this up on behalf of the Lagos State government. The Lagos State AIDS Control Agency is determined to reduce the incidence of HIV infection in the state in line with the global target.
Mr. Governor's inclusive administration, he insists on not leaving anyone behind. So there was a study that was carried out in 2011, and it was the Lagos State Modes of Transmission Studies. It found out that there are about 55.1% of the highest incidence for heterosexuals for having HIV. So basically, this group of people, they have a low risk perception. So when you look at it, the heterosexuals having a low risk perception, you find out that the vulnerable people fall into this category. So here today we have the visually impaired and the hearing impaired people. They're the ones that we've selected, and we've chosen two from each LGA. So basically we're going to run this in about 5 batches. We're going to train 100 of them. We started this training in 2018, where we've trained about 600 of them right now. So basically, when I talk about a low risk perception, you find out that because of their vulnerability, and according to what the United Nations said, we cannot attain this global epidemic control of HIV if we're not addressing the social determinants of health and vulnerability. So you find out that that's why this is not untoward that we would include them in the packaging.
In the last 3 years, more than 600 hearing and visually impaired community members have trained on HIV prevention and treatment. Some of the participants here are fully prepared to take the training to their communities.
As a person, we need to educate people about HIV so that they know what to do and what not to do. There are so many myths about HIV, there are so many facts about it, so you need to let them know. Now, in the blind community, I think that the awareness there is a little bit fair, but I think that so much still needs to be done.
This program, I appreciate Lagos State government for giving us the opportunity, because we are human, to learn more about HIV/AIDS and creating the awareness for us to check our medical status. I've learned so far on HIV for the prevention, the signs, and the solutions. When you have the signs, how will you really have the signs? You can go through some checkup, and by the time you discover that something is happening to you, you have to go in for prevention in order not to spread it. And how can you prevent it? You can prevent it by not having multiple sexual intercourse, and you have to be faithful with your partners. And it can come through using of sharp objects. Maybe you go to the salon or anywhere, you can use the sharp object. You can easily contact it from there, and from mother to an infected mother to a child, you can easily have it, and from blood transfusion.
I am having on this training on HIV/AIDS training, how deaf people can benefit, how pregnant woman who is infected with HIV can know or prevent. And that was the reason why I brought all of them for this training, to block HIV or AIDS. I will inform deaf people on how to block or the danger, or how to prevent HIV through sex or any other measure. I will inform them. And some deaf people in school, environment, community, I will teach them about it, how to prevent. They will bring the information. He said I will train people on how to prevent or block HIV or AIDS when in the school, in the community where he found himself. Maybe using of condom and some preventive measures like not using razor blades or any other person's sterilized instrument. Some pregnant women need to know about this, then how to block it in their area.
Aside from the provision of testing services, the Lagos State AIDS Control Agency also distributed printed materials in Braille.
So on behalf of the Lagos State government, to present to you the IC materials, this is basic facts on HIV/AIDS and it's in Braille. So I'm sure you will be able to cascade it. This is also to ensure HIV-free generation of Lagos State. So all what you need to know is inside in Braille. We also have one on fecal condoms and prevention, so it's also in Braille. So please make sure that when you go back, cascade all the information and use it for training and retraining in the community. Thank you. We also have oral cell test kits that, a demonstration is going to go on today. So you know how to tell your people and you know how to take their own tests and have results within 20 minutes. Okay?
Thank you very much, man. Thank you, Lagos State Government. Thank you, LSACA, for these materials. Real.
The training, the sensitization is packed in a way that it breaks it down to them. We have the interpreters for the visually impaired and for the blind. And to show you how we've been doing this in this administration, Mr. Governor has even given approval to produce the IEC materials in Braille so that there is no way that the message is not reached out to them. We're training them on reproductive sexuality. We're training them on prevention of HIV. We're also training them on COVID-19 and prevention, infection prevention and all of that.
The Nigeria HIV/AIDS Indicator and Impact Survey findings in 2018 reported that about 1.8 million Nigerians are living with the virus, and Lagos State account for more than 120,000 of the figure, with HIV prevalence of 1.4%.